Hi, I'm Karen Zwerneman, and I'm the Magnet Coordinator for Baylor Regional Medical Center at Plano. And my experience in nursing is from a management role, as well as an education role, as well as a clinical role as a staff nurse. And I think that has widely prepared me for this magnet role as a coordinator because it includes all of those aspects of nursing. I'd like to share just a little bit about Magnet and why it's important for nursing, but why it's also important for hospital systems to be Magnet designated. And when we are a Magnet facility, it is not necessarily an award, but more of a recognition practice for outcomes. So when we apply for Magnet and when we continue on our Magnet journey, we have to have continual outcomes that we're measuring. We measure nurse satisfaction, we measure patient satisfaction, and we measure our quality outcomes with NDNQI outcomes and share those continually with Magnet. On an annual basis, we have to provide information to them, but we also have to maintain our Magnet status throughout the designation period, which is a 4-year designation redesignation time frame. Only 7% of the hospitals nationwide are Magnet facilities, and that puts us at a very high mark. Within the Metroplex, we actually have several hospitals that are Magnet facilities. Definitely increases the competition among our facilities to be Magnet certified throughout our area. So just a little bit about how Magnet recognizes and rewards nurses. For one thing, we have to have strong nurse satisfaction scores, and so when we look at our annual nurse satisfaction, we have to have action plans associated with it. If there are areas that we're not doing so well in on an individual unit basis, then we have performance improvement plans to do different things to improve nurse satisfaction. We at Baylor Plano have several reward systems in place for our nurses. For one thing, we just celebrated Nurses Week, and as part of that, we recognize one nurse from each unit, each department, as the Nurse Excellence Award winner. But we also recognize all of the nurses in those areas. Everybody gets a gift bag. That's what we did this year. And we also do traveling snacks and hit all of the different shifts so that we make sure that we are recognizing nurses and congratulating them for all that they're doing. We also have shared governance councils, and so nurses are part of that. Their voices are heard. If there are issues that come up that are specific to nursing and nursing practice, then we want those people at the bedside that are actively involved in that particular practice to be engaged, to be able to share their voice and their ideas on how we can make improvements. And so as a Magnet organization, while yes, it's required for us to have shared governance councils in place, we know that that's the best way. We know that that's the best way to make changes, to be able to make our nurses more satisfied, which in turn makes our patients more satisfied with the care that they're receiving. The other thing related to Magnet and nurses is that Magnet values specialty certification. And specialty certification for nurses, we track it to make sure that we have, an increasing number of nurses being certified, but that also causes them to be a specialist in their specialty. So they are recognized themselves by holding their professional standards at a higher level than all of the nurses. We have multiple nurses certified in various specialties, like OR has a specialty certification, Med-Surg has a specialty certification. We even had our very first nurse with a geriatric certification recently, and we're very proud of that. Critical care has a certification. So every specialty area has something that they can specialize nurses in, and we really want to promote that among our staff. Specialty certification actually improves patient outcomes, and there's multiple studies in the literature that show that when nurses are certified and when we have an increased percentage of BSN nurses, that patient outcomes are better. And those are some of the standards that Magnet promotes within organizations. So Magnet has several domains. There's actually 5 different domains within the Magnet model. And within those domains, there's certain things, certain standards, certain sources of evidence that we have to provide to show that we continue to be a Magnet organization. One of those is transformational leadership. And so part of our promotion of Magnet and part of our ongoing Magnet standards and guidelines have to do with transformational leadership and sharing examples of how our leaders transform practice, and this is informal as well as formal leaders. So we need to share examples from the CNO to the staff nurse of leadership types of things and areas that we've promoted. It also includes succession planning. And so we have programs in place for succession planning of our clinical staff into leadership roles. It would be very difficult to fill our supervisor and manager positions if we didn't do succession planning and teach our clinical nurses how formal leaders work, what kinds of things they do in their job, be able to provide feedback and communication back and forth with leaders that are in place right now and what they love about their job and why they do it and why they continue in those roles. And so we have succession planning things in place. Another one of the Magnet domains is structural empowerment. And just to give you kind of a snippet of what that includes, it includes things like specialty certification. It includes things like advancing education. So we're moving towards BSN certified nurses across the board, but also promoting them in their master's programs, in their PhD programs, because we know that if our nurses are learning more, then they're also going to promote better outcomes at the bedside. And so we support the specialty certification as well as ongoing education, advanced education. Structural empowerment also includes community service. And one of the things we're proud of is that during Nurses Week, while we're recognizing nurses, Plano has a long-standing community impact as well during Nurses Week. And so among all of our staff, nurses and other staff included, we promote community service during Nurses Week. And we this year we're working with different domestic violence shelters in our area and collecting things that they have on their needs list. So along with getting things and rewards during Nurses Week, we continue to give, just as we do with our patients and families all the time. The third domain for Magnet is exemplary professional practice. And part of exemplary professional practice includes performance evaluations. How do we learn from those? Doing our own self-evaluations as well as getting peer feedback and doing the performance reviews with action plans in mind. Taking collaboratively all of the staff's input on their performance reviews and looking at what can we do differently next year in our strategic planning to help reach different levels. It also includes our care delivery model, which for us is collaborative care. We have a strong influence of our interdisciplinary partners, and so we want to make sure that in our nursing model we're also including those interdisciplinary members, interprofessional members like social work, housekeeping, engineering, because everyone plays a huge part in making sure that our patients and families are well cared for. And then the fourth domain that Magnet has out of the 5 is new knowledge, innovations, and improvement. And this includes things like evidence-based practice and putting the evidence into practice in our areas. It includes research and doing nursing research. And it also includes any of those performance improvement plans. What are we doing to get better outcomes and putting those kinds of things in place? And then the 5th domain is empirical outcomes. And within the Magnet model itself, the empirical outcomes, the data piece, actually is part of every other domain. So there's an empirical outcomes piece associated with transformational leadership, associated with structural empowerment, and so on, because we have to have the data to support the outcomes that we're trying to achieve. And so, safety outcomes, quality outcomes, nurse satisfaction outcomes, recruitment and retention outcomes, all of those kinds of things roll up into empirical outcomes where we have to share stories and exemplars and the data associated with those Magnet moments that we're really proud of throughout the organization. So one of the questions for this group was related to pay for certification and how does that work? Within our own organization, we have a couple of incentive programs to allow nurses to get their professional certification or to support them in that. And one of those is through a bonus incentive program where we pay for the nurse, or we pay up to $500 for them to sit for the exam, to buy, any types of support materials to help them prepare for the exam. And then anything that's left over in that $500 goes into the nurse's pocket. So they can choose how they want to spend that money, but certification exams are typically around $200. So the remainder of that money is to the nurse's choosing and how they want to spend that or put it into their pocket. The other part, though, is that we have something called Aspire, which we use as a way to put evidence into practice or research into practice or get staff nurse involvement to improve their practice. And that also is a bonus incentive program, and the nurses are able to get higher bonus amounts if they're certified. So that's another way that we promote certification within our organization. If they're doing nursing research, if they have an evidence-based practice project, or even if they're in school and working on projects, those can go through the Aspire program and allow them to get bonus dollars associated with that. So another question was related to the changes in Magnet this time, because we're working off of the 2014 Magnet standards that just recently came out, and our organization is kind of at a neat point, because we were at our 2-year interim reporting phase when the new manual came out, and so we are using the new guidelines in our reporting practices. So you may have heard that Magnet has made some pretty significant changes in the new Magnet manual, all of which require us to share stories and examples that are very closely tied to research and data collection. So we collect a lot of data, quality outcomes, HAP-Use, falls, central line things, and so what we're doing now to support this new Magnet manual and the requirements there is that we collect this information, we're doing lots of interventions, we need to showcase how these interventions impact our outcomes. So for instance, if a unit has an issue with patient falls, and we use that because we're required to use that as part of our data outcomes within Magnet, we also want to use that as a project to show what interventions have we done to improve or to prevent patient falls further in this area. And so our graphs are going to be a representation of falls over a period of time, at least 3 data points after intervention, but we're showing where we are, what interventions we've chosen, and then what are the outcomes based on those interventions. And there are multiple examples throughout the Magnet document that require us to use different types of performance improvement activities and show where we are. That could include patient satisfaction types of things, specific parts of our patient satisfaction outcomes, and working on process improvement initiatives to showcase those outcomes. So differences, I would say probably the biggest significant difference is that we have multiple sources of evidence that we have to show the data. We have to show the data. We have to be doing that. The other thing that's a little different this time too is that we also have to have at least one completed nursing research study from beginning to end during our period, but we're also keeping lists of all the other research studies that are in progress. So one completed from beginning to end, and also sharing that impact with, well, what did we do with that information? How did we change practice related to that nursing research? So that's a little different than we've had in the past. I will say, though, that most organizations, because of the national standards, national requirements, it's very competitive for us to compare our data with other hospitals across the nation, but it improves outcomes. And I mean, ultimately, that's what we're trying to do. We're trying to show that what we do in nursing improves patient care, and the new Magnet manual, it definitely requires us to do that in many different ways. One last thing, though, as a big piece of the new Magnet manual is that we have to be meeting or exceeding national benchmarks for those things in patient satisfaction, nurse satisfaction, and quality outcomes at least 5 of the last 8 quarters at individual unit levels. And so where Magnet before had just required us to provide organizational outcomes, now we're required to provide them at a unit level. And so every unit is incredibly important to the success of our Magnet journey. We can't let one unit slide because another one is excelling. Each and every unit individually has to report their outcomes, and so definitely it ups the bar for all of those areas within our institution. So like I said, the improvements in the Magnet manual, definitely are requiring us to showcase more of what we're doing, what our outcomes are, and ultimately all of those things are really to improve our practice and improve patient and family outcomes, which is why we're here. So thank you for listening.